Hello, everybody out there with type 1 diabetes. Today, I'm going to talk about what I think the number one thing missing from getting good diabetes care. All right, that's what we're going to talk about today. So who am I? You might just be finding me. My name is Dr. Jody Stanislaw. I help patients who are struggling with type 1 diabetes have less highs and less lows so we can have a healthy, long life. And I've had type 1 for 40 years. I normally show my decks, but I just had to take my sensor out. I'm ready for a change. So I'm just riding solo right now. I don't know what I am. You know, we all know those new sensor time for new sensor. And I've been on the phone talking to patients all over the world for the past 3 hours, so I haven't had time to. But I do have a meter. I could use the old meter. I am here to help you feel like you are empowered and healthy and vibrant living with your type 1. That is my mission, and I've helped patients virtually for almost 10 years now. So I've been coming live ever since we've kind of been in this whole COVID world, because I really want to inspire you to learn new tips and tools for how to take better care of your diabetes, to stay positive, and do what it takes to get an A1C below 6.5. The standard of care today, you know, most type 1s are not at 6.5 or lower. I just think it's really hard to get there for most people because we haven't received the education that we need and the support that we need. And that is what I'm here on a mission to change, is to give you the support that you need to feel confident in your decisions every day and how to get good blood sugar levels, right? How to stop worrying about going low all the time or high all the time and, you know, pulling your hair out, right? So there's actually quite a lot of things that I think are missing from today's diabetes care. That's what we're going to discuss today. But we're going to discuss the one thing that I think is also missing the most, and that is care for our emotional health. Having compassion for how complicated this disease is. Having the okay that we're not going to have a straight line all the time. That no matter how hard we try, sometimes this is just a slippery slope and highs and lows will happen, right? That takes a lot of self-compassion to really be able to breathe through all that. There was a great quote the other day that was like, diabetes is like playing the piano with one hand and juggling in another hand while you're balancing coolly and calmly on a tightrope. I got a lot of likes on that one. I think because we all can relate, right? We have to think about what I'm eating and, you know, what am I going to dose and, you know, or what are my hormones doing and was I active and then am I sick and am I stressed, right? There's so many variables that we're always. And so guess what? That's taxing. That's exhausting. And we need to be honored for that. I pretty much took care of myself for so many years by myself because I'd kind of given up on finding like I could find good help. And I remember one thing that's always scared me is eyes. Like I want to make sure my eyes stay really healthy. And so I would always go and get my full eye dilation every year. And this one doctor, I don't know, I was probably in my late 20s, said, "Oh my goodness." He's like, "Have you really had diabetes for so many years?" He goes, "I have never seen such healthy eyes in somebody with type 1. And I just started crying. I just was crying because somebody got how hard I worked to take care of myself. Because I bet you most people around you don't know how hard you work. Most people around you don't understand that every meal is a math problem. That, you know, if suddenly somebody says, "Oh, let's go on a run, let's go on a hike, let's go on a bike ride," and you just bolused for your dinner, they don't understand how stressful that is, right? Or if you just gave yourself a whole bunch of insulin at dinner and now it's bedtime, right? Well, gosh, now I got to worry about going low. So when I work with patients privately, I love doing the emotional side of things. It's also why I do two group Zoom calls every month. I've been doing them for over 5 years. So we make sure that we're not alone, that we feel positive. And my whole mission is that we deserve self-compassion. This is not about perfection, right? Diabetes is never going to be a straight line. You know, I like to keep a tight line. My high alarm is at 120 and my goal is to stay in there. I don't always stay there. I pop up, you know, at least once or twice a day above 120, but I work really hard and so do you. But we need somebody that gets this. That's why I'm so glad you found me. Hopefully you're following me. I've been doing these daily Facebook Lives now for over 2 months, almost 3 months now. And I'm going to be creating a membership program. I have a lot of resources on my website. If you haven't checked out my website, it's listed right there. It's drjodynd.com. And, or if it's not right there, it will be there soon. My private calls are getting pretty booked. You can check that calendar out. I'm booked out about a month though. But that's what I'm so glad you found me, because if you have type 1, pat yourself on the back, because it's a lot of work, and I want you to feel acknowledged for how hard you're working, even if you feel like your numbers are crappy, even if you're feeling like I can't do this, right? You found me. I've got lots of resources for you. There is help, there is hope. But that's why I love being a counselor to my patients, because we've got to embrace self-compassion. We've got to embrace the reality that we work really hard and most people don't realize it, right? We want to be acknowledged, and we want to be acknowledged by people that understand. I mean, it's great if you have a great care team and a great family and friends that love you, but I also think it's really important for us to be connected, us people with type 1, because we can really get it. So I want to honor you, and if you're looking for resources, I encourage you to check out my website. For my courses, I have 3 main courses. I have how to get off the blood sugar roller coaster. Just make sure you set your basal correctly, that foundation. How to dose properly for meals, because carb counting alone is not enough. And mastering your blood sugar with exercise, because you can exercise and not have to worry about eating a ton or going low. So these 3 courses, they each take about an hour or 2 to go through. They're reasonably priced, and I'm on a mission to have many type 1s to find me, and so I can help you guys as many as I can around the world. So please share this with anybody you know that has type 1. Please comment below. What are you learning from my videos? What do you like about the videos? Is there questions you want me to cover? I probably won't keep doing these 5 days a week forever. I don't know how long I'll do that, but I will stay online for, I think, probably a long time. Until all of us get cured, maybe. I don't know. Hopefully that will be soon. But we all know. I have an article actually dated 1983 that says, I remember my dad cut it out for me, and it says, there'll be a cure for diabetes within 5 years. And I still have that physical article. And so for those of us that have been in this game a long time, it can be frustrating. But such is life. Life has got a lot of frustrating things right now, and it's our job to stay positive. It's our job to find videos like this and be motivated and stay up. And I think there's a lot of positive qualities that diabetes gives us, resilience and responsibility and discipline and, critical thinking. There's definitely gifts that can come out of this challenge. So thanks for watching today. Check out my website, and I'll see you tomorrow. Bye for now.